If you're wondering whether your bunion is bad enough to need surgery, I was asking myself the exact same question. Before my surgery, I spent months trying to understand what bunion surgery involves. And today, I want to tell you how I finally made that decision. Hello and welcome to my channel. My name is Roxana, and on this channel, I share something a little different. I've gone through a series of real-life experiences, some of them health-related, and I know how overwhelming it can be when you're searching for answers and all you find are fragments of information. My goal is not to give medical advice or to replace the doctor, but to share a real-life insights. And I think that the fact I'm a biochemist naturally shapes the way I look and understand these experiences. So what you'll find here, it's a blend of the honest perspective of someone who has actually lived these moments and the clarity that comes from understanding the science behind them. Now about my bunions. Well, just like everyone else, I hoped my bunions could be fixed without surgery. And honestly, that's completely normal. Bunion surgery is never presented as something appealing. It's not a simple procedure, and it limits your mobility for a while. So, of course, you hope there are other ways. Just like many people, I started by reading about every possible non-surgical options. Exercises that supposedly correct bunions, tooth spacers and other devices, and even some almost amusing suggestions like creams and massages that claim to realign the toe. But once you understand what a bunion truly is, and once you talk to enough doctors as I did, you eventually realize that once it reaches a certain stage, this problem can no longer be corrected externally. That's how I finally understood that surgery was the real solution. And once you reach this conclusion, it's natural to start thinking about how to do it in the safest, most effective way possible, with the highest chances of success, the lowest risk of recurrence, and the least amount of suffering. And that's where the real challenge begins. A bunion is not just that visible bump on the side of the big toe. The real problem is the change in the position of the big toe itself, and that happens because the metatarsal bone has shifted. And that is what needs to be corrected. I won't get into the debate about what causes bunions, because there are many theories, from genetics to the type of shoe we wear, and it's a discussion with no clear definitive answer. But what truly matters is understanding that the root problem is the bone alignment. The real problem is the change in the position of the big toe itself, and that happens because the metatarsal bone is misaligned. So the correction must happen at the level of the metatarsal. During the surgery, the metatarsal bone is cut and repositioned to restore the proper alignment of the toe. Of course, the bump is also removed, but it's important to understand that the bump is just a consequence, not the root cause. The real fix is correcting the alignment of the bone, not just shaving off the bump. There are many different types of bunion surgeries, from the classic open procedures with larger incisions to minimally invasive techniques with smaller cuts, and even ultra-minimally invasive approaches where the incisions are almost tiny dots. But regardless of the technique, they all involve the same fundamental step: cutting the metatarsal bone and repositioning it. Where the surgery actually differs is not only the size of the incision used to reach the bone, but especially in how the cut bone is stabilized afterward. Some techniques use screws, others use small plates, and some use external fixation methods like special bandages. All these factors influence how invasive the procedure is, how comfortable or uncomfortable the recovery will be, and how the overall healing process feels for the patient. There are also differences in the type of anesthesia used, from general anesthesia to regional or local anesthesia, where only the lower part of the leg is numbed. And, of course, one of the most important factors is the surgeon. No matter how good a technique is, the outcome depends greatly on the skill and the experience of the doctor performing it. In my case, I knew from the beginning that I wanted the least traumatic option possible with the easiest recovery, especially since I was planning to have surgery on both feet. After researching all the available options, I decided on an ultra-minimally invasive technique performed under local anesthesia without any metal fixations such as screws or plate. From there, I started consulting surgeons who specialized in this type of procedure, both to determine whether I was a suitable candidate and to choose the right doctor for me. It's important to be honest about what bunion surgery is and what it isn't. This is not the kind of procedure where you walk out the next day as if nothing happened. There is swelling, there is discomfort, and there are several weeks during which your mobility is limited. Some techniques are gentler than others, and some recoveries are definitely easier, but overall, bunion surgery is a physically and emotionally demanding experience. That being said, demanding does not mean traumatic, and I think this distinction is very important. For example, in my case, I didn't experience pain. And with the right technique and the right surgeon, you should not experience pain. I'm sharing this not to minimize the experience, and certainly not to scare anyone, but to help set realistic expectations. When you know what you're walking into, the whole journeys become much easier to manage. Trust me.